Ladies and gentlemen, for his speech, I would like to invite the Honorable Minister of Power. Notice how I'm calling the power. The Honorable Minister of Power. Ladies and gentlemen, invite to the stage Chief Adebayo Adelabu. Please give him a powerful hand clap. Everything has to be power. You can notice my voice has increased in its power now. Thank you very much.
The President, Commander-in-Chief of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, ably represented by our leader, our mentor, and an astute administrator, His Excellency Senator George Akume, CON. Thank you so much for joining us. Your Excellency, the Coordinating Minister of Health and Social Welfare, Professor Mohamed Pate, the Honorable Minister of State for Health and Social Welfare, my dear brother, Dr. Lakunle Salako, the Chairman, Senate Committee on Power, and his counterpart, Senate Committee on Health, the Chairman, House Committee on Power, and the Chairman, House Committee on Health. Honorable Commissioners for Health and Power from the states, directors, the Permanent Secretary of the two ministries, Ministry of Power and the Ministry of Health and Social Welfare, representative of the Head of Civil Service of the Federation, all the directors in the Ministry of Health and Social Service and the Ministry of Power, all heads of government agencies here present, CMDs of health institutions, our development partners from the World Bank and the United Nations, esteemed stakeholders from the power and health sectors, gentlemen of the media, distinguished ladies and gentlemen. For whatever I've missed out, I also crave your indulgence to rely on the already established protocol. Thank you for that. It is my honor and privilege to welcome you all to this landmark event, the first National Stakeholders Dialogue on Power in the Health Sector. Today marks a critical step in our collective efforts to strengthen the link between reliable energy access and the delivery of quality healthcare services in Nigeria. The relevance of this National Stakeholders Dialogue cannot be overemphasized, as it provides us with a unique opportunity to focus on the intersection of two critical sectors, power and health. By bringing out collective expertise to the table, we can chart a path that strengthens healthcare delivery by ensuring sustainable, reliable, and affordable electricity supply to facilities across Nigeria, from the primary health care centers in rural communities to the teaching hospitals in urban centers, so they are fully equipped to serve the needs of our people. Equally important, today is proof that Nigeria is ready to approach development differently. Too often, our sectors have worked in silos, each pursuing their mandates independently. But the challenges facing our nation, whether in health, whether in education, or infrastructure development, are interconnected and interwoven. Without reliable power, health systems cannot function effectively. Without a healthy population, productivity and economic growth cannot be achieved. Electricity or power supply is actually the lifeblood for any economic growth and industrial development. And it actually cuts across all critical sectors. It's a common denominator, both in developing countries and in the advanced world. There is no critical sector that can perform optimally without stable, reliable, and functional energy source. Not just in health, even in education, in every facet of our daily lives. So it cuts across. By bringing together the power and health sectors, we are sending a clear message, which is CCP, collaboration, cooperation, and partnership. It is no longer optional. It is essential. We should stop working in silos. We must collaborate, we must cooperate, and we must partner to achieve a desired end. This partnership between both ministries strengthens the support of the development partners and private stakeholders. Is the model we must replicate across other areas of governance, because collaboration is how we turn policies into real impact for our people. To your excellencies, the coordinating Minister of Health and Social Welfare, Professor Mohamed Ali Pate, and the Honorable Minister of State for Health and Social Service, Dr. Ishaq Adekunle Salako, I say a big thank you for also enabling this cooperation between our ministries. Thank you so much for that receptive hand. The renewed hope agenda of Mr. President clearly identifies access to power and access to quality health care as top national priorities. By empowering health care, we are advancing both priorities at once. It's like using one stone to kill two birds: the stable power priority and the health sector priority. This dialogue is therefore a practical step in operationalizing Mr. President's vision on human capital development, infrastructure renewal, and social inclusion. And let me state at this point that Mr. President has done his part. He has given us the conducive atmosphere to allow every sector thrive. What we are having today would not have been possible if not for that. And I will make mention of just 3 items before I continue with my speech. Number 1 was the signing into law of the Electricity Act of 2023. That was the first bill Mr. President signed. Immediately he resumed in June 2023. And that is what makes this possible. Why? That bill has 2 important aspects. Number 1 is the decentralization of the power sector. For all of us here, we all know that between the independence and up to 2023, the sector has been over-centralized. We used to know the Electricity Company of Nigeria, ECN, in the 60s. We all knew about the National Electric Power Authority in the 70s up to late 90s, which transformed into the Power Holding Company of Nigeria in the early 2000s up to 2015, 2013. All these were centralized government agencies. For a country that is as huge as almost 1 million square kilometers of landmass, of over 200 million people, of 36 states plus the FCT, of 774 local governments, of almost 10,000 wards, centralization can never work. So with this act, power sector has been decentralized. We never used to have commissioners of energy in the states. Today, the sub-national government can participate fully in operationalizing the power sector in all segments of it, from generation to transmission to distribution. Even ministries now today are able to do that because of this singular act of Mr. President. Otherwise, everything would have been concentrated at the federal level. Even local government today are allowed to. That is the decentralization. Then the second aspect is the liberalization. Power sector is no longer government business. It's no longer government sole business. The kind of investment requires to transform or reform this sector can never be provided by the federal government alone. There are competing needs in other critical sectors in federal government. We have works, road construction across, bridges, we have education, we have health, we have defense, we have all other sectors that are competing for limited funds. So thinking that government can fund the power sector 100% is not valid. So we must catalyze private sector investments. We must include development partners, the World Bank, the AFDB, the AFD, the JICA, all of them must take part. And today, we are achieving that. There are now a lot of private sector investments in the private sector, in the power sector. The World Bank are more active than ever. African Development Bank, the same thing. Japanese National Cooperation Agency, the same thing. The German GIZ, the French Development Agency, AFD, the same thing. And even the number of private sector renewable energy firms today, they are uncountable. It wasn't like that before. It was because of this Electricity Act of 2023. So I think we need to applaud Mr. President for giving us that conducive atmosphere to enable us all to participate in this power sector that requires all hands to be on deck. Then the issue of policy. There was never a coordinated, comprehensive, integrated national electricity policy in this country in the last 21 years. So the ministry has been able to put something together that is now called the National Integrated Policy on Electricity in Nigeria, which has defined the functions of all stakeholders in this sector, the role anybody can play in this sector. Whoever wants to bring in money to invest here, they know their limitations, they know the opportunities available. So that has also helped to revitalize this sector. The number two from Mr. President is the approval for the energy transition plan for the country, which is targeting the carbon neutrality by year 2060. This has allowed us to embrace our distributed renewable energy concept, the DRE, that will achieve two things. Number one, it will achieve reliability of our power supply. Number two is the fact that it will also eliminate pollution of all forms. The intention is to eliminate fuel and diesel generators, which is also not good for our health. So you can say that the power and health are actually interwoven, and we are pursuing this one diligently. We have a midterm plan of year 2030, by which time 30% of almost 30,000 megawatts of power should come from renewable energy. It is called Vision 30-30-30. And we are on course to achieve the 2060 carbon neutrality or net zero targets. And lastly on that is the cost dilution. Majority of the health sectors are no commercial businesses. They are social institutions. It is tough for them to afford the high cost of providing electricity. Let's even forget the issue of diesel and fuel generators, where teaching hospitals incur average of 30 to 50 million on a monthly basis. That is grossing almost 600 million in a year. Where do we expect them to get such allocation? Even the grid, the cost of grid electricity provision is also not affordable to these social institutions, whether at tertiary, at secondary, or primary healthcare level. So the introduction of renewable energy will also achieve some level of cost dilution. Between 7 a.m. in the morning till 7 p.m. in the evening, our institutions should be on solar source of energy. And I said something in Accra last week. We attended the International Solar Alliance, where we signed a country support partnership with ISA of India. I said, solar is meant for Africa. Solar source is for sub-Saharan Africa. In fact, it's made for Nigeria. There is no state in Nigeria today that is not guaranteed minimum of 8 hours of sunlight. We have some extreme whereby we have 12 hours of sunlight. What do you need again? Even in Europe, where they don't have such long hours of sunlight, solar is effective. Those solar home systems, interconnected mini grids, off-grid solutions, and even utility scale solar energy. Till today, our grid source of power are still two: hydro and thermal. A country with such opportunities for sunlight. We don't have solar input into our grid electricity, which is, in fact, is something that we should not even talk about. So we are working on that. So that will dilute the cost for these institutions. And I also believe that currently, the Federal Ministry of Power, through the Rural Electrification Agency, is deploying solar hybrid mini grids, standalone solar home systems, and other innovative solutions to electrify hundreds of healthcare centers across the country, which has been alluded to by the World Bank acting country manager and my dear brother, Dr. Salako. Rural Electrification Agency, REA, deployed 50 kilowatt solar mini grid solutions to about 100 healthcare facilities across the country during the COVID-19 pandemic, ensuring that critical health centers had uninterrupted power supply to preserve lives, support medical staff, and sustain essential services at a time of unprecedented national emergency. In addition, through the Energizing Education Program, EEP, of the Rural Electrification Agency, we are deploying solar hybrid mini grids to teaching hospitals across the country. We have plans for 37 teaching hospitals, but today we have commissioned a 12 megawatt system at the University of Maiduguri. I think I saw the VC not long ago. Yes, I think it was somewhere around. I personally commissioned this and it's working perfectly. In fact, they are not using more than 5 megawatts out of 12 megawatt that we installed. They have now started even supplying energy to nearby institutions. Now, there is a 7 megawatt system at the University of Calabar Teaching Hospital, which is also effective and is working. And the last approval of the Federal Executive Council about 2 or 3 weeks ago, we have approved for University of Ibadan, for University of Lagos, for Obafemi universities, and a couple of other institutions. All I want to say today is, why did we have to wait till this time? Why did we have to wait till this time? Rome was not built in a day. But if we have been taking this kind of significant steps in the past, we will know where we'll be today. But I believe it is better late than never. Let's thank President Tinubu. In addition, these deployments are not only providing reliable, clean power, but also helping to properly segregate electricity supply for clinical activities from that of residential and commercial activities within the hospital environment with accurate metering in place. This ensures that non-medical businesses do not hide under the hospital's electricity allocation and make energy bills unaffordable. This is very, very key. There was a time UCH in Ibadan, which is my home base, had issues, lingering issues for months. And I got in there. We did our research, we did our study, and we found out that even in the teaching hospital campus, non-medical activities were like 70%, and they were hiding under clinical activities. And they are putting the bill, the burden of the bill, on the hospital, it is not possible. And that was because there was only a single metering for the entire teaching hospital. We said, no, we have to break this down. There must be appropriate metering. Let clinical activities be metered separately. Residential activities, even for the doctors, be metered separately. Business activities within the hospital premises be metered separately. There were shops where they sell ice blocks. They make ice blocks. There were bars, drinking joints. There was a particular business too that was consuming so much power. Dry cleaning business all over the place. And all of them were actually putting their bills on the hospital. The same thing happened in the University of Benin, where I also intervened between the Benin Electricity Distribution Company and the University of Benin itself. So we must go to all these institutions and cleanse them of such obstacles and hindrances that can ensure reliable and affordable electricity. So with accurate metering in place, I think I've taken this, the hybrid model further allows for an optional mix of renewable energy and grid supply, thereby reducing costs while guaranteeing sustainability. Uninterrupted electricity for clinical medical operations. By blending renewable energy with grid supply, hospitals are shielded from the high costs and unreliability that come with depending solely on grid electricity and diesel generations, enabling them to achieve a more stable, predictable, and affordable energy expenditure. These interventions have delivered measurable impacts, from vaccine storage facilities, which are now functional in remote communities where electricity was previously unreliable, to maternal and child health services, which are improving in rural areas because doctors and midwives can now conduct deliveries at night with reliable lighting and powered medical equipment, to cold storage for essential medicines, which is now possible even in off-grid locations. And emergency services are no longer constrained by darkness or unreliable power supply. Your Excellencies, these are not abstract achievements. They represent real lives being saved, communities being empowered, and healthcare being brought closer to the people. The work of the Rural Electrification Agency demonstrates that sustainable, renewable energy solutions are not just viable but scalable. What we have seen is in these pilot projects must now be expanded nationwide. We need to expand it. Yes, all these pilots, all this proof of concept that we have agreed that the way to go is distributed renewable energy. We must now extend it and deploy it to all tertiary, secondary, and the primary health institutions. The Federal Ministry of Power, under the renewed agenda of His Excellency President Bola Ahmed Tinubu GSFR, is further committed to working with the Ministry of Health and Social Welfare to ensure that no hospital, no primary healthcare center, and no diagnostic laboratory is left in the dark going forward. That is our commitment. We will harness renewable energy, distributed generation, battery storage system, and grid expansion to provide the reliable power backbone that the health sector desperately needs. Ladies and gentlemen, this commitment is clearly for the health sector today. We have our open arms to receive every other critical sector that are paramount to transform the lives of Nigerians for better. The work of the ministry is not on standalone. We now work jointly with every other ministry that is ready to cooperate with us and change their lives. The task before us in rounding up is both urgent and achievable. We must scale up electrification projects for healthcare facilities nationwide. We must strengthen the policy frameworks that make investment in health sector electrification attractive and sustainable. Your Excellency, the Coordinating Minister, this is very important. We need to catalyze private sector investment for this to work. And they must see a line of sight on how they can recover their investment and the returns on this investment. So We must expand financing structures that blend public funding with private capital and donor support. Most importantly, we must institutionalize collaboration so that no facility, no community, and no Nigeria is left behind. This is not just about powering buildings. It is about powering hope, powering dignity, and powering the future of our nation. In closing, I will once again thank His Excellency President Bola Ahmed Tinubu GSFR for his leadership, for his support, and for his vision to achieving sustainable development across all sectors in the country, especially the power sector. The support has been tremendous. We know all that we passed through last year, the instability of the grid, the epileptic supply, the pain of tariff increase. Since December last year till today, 10 months and still counting, we have never recorded a single grid collapse. Thanks to Mr. President. I want to also thank the Honorable Minister for Health and Social Welfare, the Coordinating Minister, as well as his Minister of State, for upholding the ideal of Mr. President's renewed hope agenda through this collaboration. Our development partners, the World Bank, WHO, AFD, GIZ, JICA, all of you together, and all other stakeholders represented here for your commitment and for your interest in seeing our country through. And they say that if you want to walk very, very fast, you can walk alone. But if you want to go very far, you walk together. You have demonstrated that you want to work together with Africa, with Nigeria. We appreciate it. So let us have this dialogue, not only with good ideas, but with renewed determination to implement them. Let today mark the beginning of a new era where every health facility in Nigeria, no matter how remote, has the electricity it needs to deliver life-saving services. Thank you, everyone. I'm happy to be part of this, and I believe you are also happy. God bless the Federal Republic of Nigeria. Thank you very much.
Please, can we